In the field of cosmetic surgery, many of the operations we perform require some degree of post-operative compression. If we start from the top of the body and work down, the first thing that comes to mind is a facelift. In a facelift, we undermine the skin and fat of the face, leaving an open space. It's very important to compress that so those two surfaces heal quickly and efficiently. So oftentimes, we will put a face and head dressing on that creates that kind of compression, and sometimes after we take it out, if we think further compression is necessary, we'll use what's called a chinstrap. As we work our way down to the breast area, different breast procedures require different types of compression. For example, in a breast reduction, we've opened up a lot of spaces, created some potential space for fluid to collect, and so we'll put those patients in a bra to keep not only that space compressed, but to help in the molding and shaping of the new breast. And usually that particular bra is used for the first week or 10 days, and then we let them transition into something like a sports bra after that. When we perform breast augmentation, we generally wrap those patients in an elastic bandage right after surgery, usually take that off on the first post-operative day and transition into a sports bra. Sometimes, if we're looking to do different type of molding maneuvers on the breast, we might add some taping or a Velcro band on the top of the breast to help keep the breasts in the position we want them to heal in. As we work down to the abdomen, most common operations in the abdomen would be a tummy tuck or liposuction. In a course of a tummy tuck, we lift off the skin and fat layer off of the underlying muscle layer, creating a relatively large open space. It's very important for that space to heal to itself, obliterate that space, and decrease the drainage. The drainage occurs because the raw surfaces are still open and there's a space that allows the fluid to accumulate. So very commonly we'll put a Velcro binder on the tummy tuck patient for as long as necessary. Oftentimes the patients will wear those up to 2 weeks. Liposuction is another very common abdominal procedure. When we perform liposuction, we take a tube that has a blunt end to it and it's hollow, and the blunt end breaks up the fat and it's delivered through the tube into the suction container. Now, if you look at a cross-section of that tissue when we're done, it would look like a honeycomb, a lot of canals that are created to remove the fat. It's very important to collapse all those tunnels uniformly to get a nice appearance. And so after liposuction of the abdomen, we will use the abdominal binder I mentioned. But in this operation, it's even more important to be attentive to how it fits, because often there's some loose skin after just removing the fat. So it's very important to check the fit of that garment several times a day to make sure there aren't any unwanted creases developing. Liposuction of the hips and thighs generally are treated with 2 pairs of pantyhose. We find 2 pairs of pantyhose give enough compression. They're easily found, easily obtainable, and relatively cheap. When we do that, we do cut a hole so the patients can utilize the bathroom during the first week, because we usually tell them to keep it on for the week because it's somewhat uncomfortable to put it back on. And then we ask them to wear that compression for another 3 weeks after the operation. It's very important to follow the directions of your surgeon regarding the post-operative compression, because the outcome you're going to have is a combination of proper patient selection, performing a good operation, and providing good supportive care afterwards.